So I'm Chris Leone, and I'm the quality manager and director of regulatory affairs here at
Okay.
Capillus.
That's quite a meaty title.
Yeah, it's so quality and anything that has to do with regulatory bodies like the FDA. Because even though it's very low risk, what we do produce here is considered a medical device.
And I think that's a good starting point because one of the things when we're looking at companies and brands and what we want to choose, the fact that Capillus, these products are FDA approved,
And the correct term is FDA cleared.
FDA clear. Okay.
Exactly. They've been on the market for quite some time. We followed a predicate device,
Yeah.
and the FDA basically gives the stamp of approval that yes, this is a medical device.
So maybe you could tell us about the technology behind this.
Certainly. So it works through the process of, wait for it, big word, photobiomodulation. That's just a big fancy way of saying that the light stimulates your cells.
Okay. Wow.
And that's how it works. It's light therapy. So it's not invasive. There are no drugs involved, although you can use it in conjunction with other therapies like minoxidil, and no contraindication there. So they can be used together with other therapies. But the wonderful thing is, like I said, it's not invasive and it treats you just using visible light.
So you can use it by itself. You don't have to use it in combination with something like minoxidil or fast.
Exactly. You could use it by itself.
Okay, so how does it work? So you put the cap on every day, a couple of times a week. How does it work?
Sure. It's a daily treatment once a day,
Yeah,
6-minute treatment.
6 minute treatment.
So basically, in the time you finish your cup of coffee, you're done with your treatment.
Your first coffee, right?
Exactly.
Okay.
Helps with compliance. So
Now, the thing that really struck me about this was I thought it looked quite cool. Yeah, it's on it, and that matters if you want to use the product. So, what you see, you just put it on your head. Can I try it on?
yeah,
Is that
go ahead. Yeah.
And is this just it? I don't need to plug into anything?
Nope.
So I could like walk around and do it okay. So I just like put it on my head.
Mhm. That's it.
Okay. And
Press and hold the power
press and hold
button,
the power button.
and there you go. The fact that it's lit up right on the top means it's already working. It's communicating with the
Okay.
cap, and your cap is on.
So what? And I'm like, but that's so what? So I don't feel anything. Now I do
And
anything.
you're not gonna feel anything because it's visible light.
Visible light. Okay.
You might get a little bit of warmth to the end just because just like, in wintertime up north, you put on a hat, right, to insulate yourself. Your head radiates a lot of heat, as do your hands. So just the fact that you have a hat on, maybe towards the end of the treatment, you'll feel a little warm, but it's not a heat treatment, it's a light treatment, and the light is just visible light.
I mean, that's incredible because obviously it's so easy. And the fact that you don't have to plug it in, I think that's a massive benefit for the actual use. Um,
Very portable and comfortable. I've seen other units, and even the oldest iteration of our device used to have like a hard plastic
yeah.
inner shell. Now it's nice and soft silicone,
Yeah.
so it's comfy on the head. You could wear it around.
Easily. Yeah.
You would think it's even 4 lights on top of the battery to tell you the level of charge. We still occasionally get someone saying, "It's not working right." Right.
Yeah. A deep breath.
Yes.
In 2, 3, 4.
Pressing a button, it's challenging.
Yeah, no, I understand your frustration, but obviously when somebody is looking at something for the first time, maybe they're thinking they have another device that behaves differently.
Wait,
They're like, "Oh,
Now there is a sensor in the cap.
yeah,
So the sensor is just so it won't turn on if it's not on your head. That's
okay,
all.
fantastic."
So,
And you don't need to wear glasses, cover your eyes, anything like that?
nope.
Okay. Um, so have you got any funny stories with this?
Oh,
Come on, you
do I ever? So on occasion,
yeah.
and again, it's not a claim we make because it doesn't happen all the
Yeah.
time, but every once in a while, um, if you use the cap and you have gray hair, which at my age I certainly do, sometimes in some people, some hair follicles will repigment. So
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 in our language, that means like as in you get your hair color
they're
back.
back. Exactly. So and it's, even the woman who used to be my boss actually mentioned it one time when she started using the cap
Yeah.
and she got a hair that came off and she saw the top part of the hair was gray and the lower part was brown, her hair color again.
Yeah.
So one time we actually did get a
Before you tell the
sure.
story, can I just ask you, how is that happening? Because that's wild, but also amazing.
Yeah. So the way it works and
Yeah.
the way light therapy works with red light therapy is that the parts of your cell that make energy, the mitochondria, right? Taking back to third
Yeah.
grade there,
Yeah. Thank you.
uh, they make what's called ATP, which is what your body burns and uses as energy. When your car uses gas, our bodies use ATP.
Yeah.
So what happens is as you get older, sometimes, you know, you get a little more tired, things get a little more run down. But what happens is the mitochondria also produce less energy than they used to in their youthful state.
Okay.
With red light therapy, the mitochondria contain sites on them called chromatophores, which they absorb light. And one of these sites happens to be right at that little microscopic engine that makes energy. Looks like a little windmill that turns, actually looks like a little gear. And it stretches the ADP molecule and adds another phosphate on there, and that's a high energy bond. So since it absorbs light at that place, it makes the mitochondria work more efficiently. That way you could get an older cell that now all of a sudden has energy levels as it did when it was much more youthful.
You are literally dealing.
Turning back the clock.
We love
Yeah,
that.
please, it's
To do that.
exactly
Okay, so you were about to tell us you had a situation. So somebody,
right. Because you can't please everyone. So someone actually wrote in and they sent a letter and they sent hair in the envelope and they said, you know, I've got my old hair color back and I don't like the color. So she's growing hair. We've turned back the clock and she's really rather upset about it because to which my only response is, lady, dye your hair.
in a way, that is like the holy grail for a lot of people that when their hair is getting gray and yeah. So if you said to somebody, okay, you can reverse the clock because not only is your hair, if you're lucky, getting some pigment back, but it's healthier. Right? Your cells are behaving are more youthful.
The cap isn't for everyone.
Yeah.
And the reason for that is that it's clear to treat androgenic alopecia.
Okay, can you
Okay.
break that?
I'll walk that back a little bit. So androgenic alopecia is the number one cause of hair loss in adults. Okay. Uh, and it's just basic, it's an inherited condition.
Yeah.
I have it too. I don't have my hairline moves back as I get older. It happens to everyone. Now, if you're completely bald, right, the cap isn't for you because that means your hair follicles have already died. And as good as our cap is, it does not resurrect the dead. So,
Yeah.
so that's why there are certain patterns that it's recommended for, because obviously if you're not experiencing any hair loss, it's not going to do anything.
Okay.
And if you've already experienced the extreme where you're completely bald, it's also not going to do anything because the hair follicles have to be alive. But as part of this process, because androgenic alopecia is considered a disease since it is an aging process,
Okay.
your hair follicles get miniaturized. They kind of start shrinking, and the hair they make gets smaller. So if you take a microscope on my scalp right now, you'll see a bunch of little, tiny little baby peach fuzz hairs. Those used to be thick, full, long hairs,
Okay.
right? But as you get older, like I said, they deminiaturize, and then eventually that hair follicle will die, and then it'll just produce nothing at all. So the whole turning back the clock thing,
Yeah.
since it gives the cells more energy and it helps with microcirculation to also bring more blood,
Yeah.
over to the hair follicles, what ends up happening is it reverses the process of the miniaturization. So those hair follicles that are now tiny and just making little peach fuzz hairs, you'll shed that little peach fuzz hair, and the hair follicle will get bigger again, and will start producing thicker, healthier hair.
So does that mean when you're say you start a treatment with this cap, you might initially have something where it looks slightly worse before it looks better.
Well, what people
So,
and this is a
yeah.
common thing, and it's not just with our cap, it's
Yeah.
anyone who uses the technology itself, it's light therapy. Because of that, and your hair has different phases, which I don't have committed to memory, but one is, you have a growing phase and a resting phase and a shedding phase, right? So what happens is one of those phases is longer than the other, and when you use the therapy, one of those gets longer. So more follicles sync up into the shedding phase at the same time. So you shed that hair. So you initially experience an abundance of shedding.
Okay.
So some people get freaked out by that because they're, but I'm using this to not lose hair. And no, I'm losing a lot of hair. So it can be very distressing. I get it. But it's a natural part of the process. And what ends up happening is that hair leaves, it comes in and gets filled in with thicker, healthier hair. And that's why your hair starts looking fuller after using it for 3 to 6 months, because those little invisible baby peach fuzz hairs that you had are now replaced by thicker and longer hair. And as that grows in and fills in, you can see the difference.
Yeah. I mean, 3 to 6 months is still relatively, that's quick, isn't it?
Right. I mean, microwave generation,
Yeah.
10 seconds, but I want it now. So I understand I'm impatient too. Unfortunately, hair only grows about a centimeter a month tops. I think, no, I might be wrong on that. So, but hair grows not overnight, obviously. So you need to give it the 3 to 6 months before you can really notice that.
The other thing you were talking about there was obviously if you're bald, now that's too late to do something like this.
Mhm.
If somebody's watching this, they're trying to think when is the right time? Because we're trying to be proactive about our health.
Right. So right on our box, we have the indications for use. And so you have the hair loss patterns. And the hair loss patterns will indicate, okay, yes, you know, these are the hair loss patterns that qualify for treatment, and these are the ones that don't.
Okay.
So, and they're nice little diagrams and very easy to follow.
Yeah. Have you found that this works just as well for women?
Yes. As a matter of fact, it's cleared for both sexes. And I believe it was originally cleared for women. Actually, the
Okay.
original clearance was for women.
Okay.
So
To know we haven't thought about it.
yeah.
Um, before we started filming, we were talking about this technology, and I wondered if you might chat again about this deep sea divers oil rig analogy.
Sure.
It was really helpful for me to understand that.
I think it brings into perspective. It's a little anecdotal story that I tell pretty much all the employees we onboard when I train them. Deep sea oil rigs, right? Oil rigs obviously have parts that go very deep, and these require maintenance and repair. Unfortunately, if you know anything about scuba diving, you have what are called dive tables, which say how long you could be down at a certain depth. Because as we're down underwater for an extended amount of time, things start happening to our bodies. Nitrogen starts dissolving into our blood, right? And obviously, we have to be able to expel all that before we come back up. Otherwise, it could lead to a dangerous condition. And also, nitrogen can become toxic underwater too. It's called nitrogen narcosis. You could actually get drunk off of the nitrogen, just like you would if you have, a couple drinks in you. Not a good idea when you're scuba diving. And also, oxygen becomes toxic. So, the very thing you need to survive and live has a toxic effect on you when you're under pressure. So, what they do is they take these guys and they put them in a little room that's at depth, and there they treat the air. They take all the nitrogen out and they remove a good amount of the oxygen. That way, you're not going to be affected by the nitrogen. And with less oxygen, you're not going to have all those toxic effects from the oxygen. And they replace that with helium because helium is non reactive, right? Which has a funny effect if you have these big burly guys who talk like Minnie Mouse in there, So always fun to watch those documentaries. But at the end of the day, there's a downside to this, which is your body needs oxygen for energy. So if you get hurt, if you hurt yourself, if you cut yourself, it's going to take twice as long to heal because your body just doesn't have the oxygen to burn off to heal it at the normal rate it was if you were up on dry land. So what ends up happening is if you shine our little lasers on it, you're going to heal just as fast as if you were up on dry land.
That's
There's
incredible.
no delay in the healing time. It just goes to show that it does such a good job making those little mitochondria work efficiently and make energy efficiently that even with that oxygen deprivation, they can still function normally as long as they've got that to kind of grease the gears.
Incredible. Thank you, Chris, because that really, I think, crystallizes it. Um, Chris, if you could wave a magic wand and impart one piece of knowledge or information about this to our audience, what would that be?
I guess it would just be if you're using it, use it consistently.
Consistency.
So compliance is a key to getting good results.
Like it feels to me like it should just always be good for your scalp or
Oh,
to be getting this
well,
energy.
and to be clear, there's really practically no contraindications. So it's not going to hurt you. I mean, again, if you've got problems with visible light, you've got bigger problems than hair loss. Right. So yeah, if you're rare conditions where you're allergic to sun or if you're taking photosensitizing medications, but other than that,
Okay, got that.
visible light, you know.
Yeah, it's great. Okay, well, I think maybe we have enough on the so maybe we can chat about some of the other products.
Mhm.
I noticed you guys are doing shampoo and conditioner and serum. Can you tell me a little bit about those?
Sure. So we do have a wet line of products that are formulated with hair loss in mind, and those are specially designed to try to maintain a favorable environment in your scalp for hair growth. Androgenic alopecia unfortunately comes along with different phases, right? And one is pore clogging, where basically the pores. So not just you have a hair follicle that's shrinking down, but now you have the problem of the pore that the hair is supposed to come out of gets clogged, right? So obviously, shampoos can be formulated to try to help with that situation and help make sure that those pores aren't clogged so that we make sure all the boxes are checked to optimize your hair growth journey.
Maybe we can just can I
Sure.
have a look at what they so it's good to
So that's a derma roller,
yeah.
and that's basically microneedling.
Okay.
And again, that's to it only hits the surface of the scalp, and that's to encourage the pores to have free access for your hair to come out of.
So you would use that for your shampoo then? Is that right? Or
Um,
after or
really doesn't you want your scalp to be clean when you use it,
okay.
but it is only 0.3 millimeters or less, so it really is just the very surface of the skin.
Of the skin.
Exactly.
Fantastic. Another project that you were talking about briefly, okay, we'll put it from here,
Sure.
is this. Maybe you can talk about this because I think a lot of people get lower back pain. This could be a
Yeah.
bit of a miracle.
So once again, this is the Curvy,
Yep.
and same basic principle and technology. Uh, it just so happens that light therapy is not just good for hair follicles,
Yeah.
but it also decreases inflammation, which is the first step in healing, right?
Okay.
So this is an adjunctive therapy. What it is for the temporary relief of pain and soreness. And by decreasing inflammation, you allow blood flow to go back into areas that are damaged, sore, and hurt. And that, again, is your first step in healing is establishing good blood flow there so that things can start getting fixed. Uh, so just like light therapy helps your mitochondria make more energy,
Yep.
it does other things as well. Cells are very complicated. I always say to imagine it as almost if you're making lentil soup. You have all these things floating around in there, interacting and doing their own things. So we don't know exactly the mechanisms by which it's doing what it's doing, but we do know if you take cells that are having an inflammatory process and you take a sample and you analyze it, you find all these things in there like tumor necrosis factor and interleukin 2 and all these, chemicals in the soup that cause inflammation and do all this stuff.
Yeah.
You do your light therapy session, you take another sample, and you see that all that stuff is decreased.
That's incredible. I mean, and
So
when you say decreased, are we looking like talking about like a tiny bit, or is it
enough to have a
enough?
clinical impact.
Wow.
So
So then just looking at how this works. So this literally just wraps around.
Exactly. Just wraps around your waist,
Nice.
and
Okay.
you have diodes there. Put
Yeah.
out the lasers, you put it on, and same basic principle. Touch the button, and they energize, and
Uh,
that's it.
I know you're a bit of an expert on this. I'm just gonna ask this. So how do you turn it on?
It's really good. Pressing the button, yeah.
Okay, you press the button.
Press and hold, and it
But
pops right on.
um
And once again, you have a time session, and that'll pop up on the display as well. So
okay, yeah, I see. So 30 minutes,
it's actually 15-minute.
15 minutes.
Yeah,
Okay.
intervals.
So it's on that. Um so again, you don't have to have this plugged in
Right.
using it.
You just plug it to charge it, not to use
Fantastic.
it.
Because this
So
is
it's
on the practical side that
very convenient in terms of you don't have to be immobile
light.
or fixed in one spot while you're doing your therapy.
Fantastic. Okay. That
And again, the other nice part is non-invasive,
yeah.
right? No drugs,
Yeah.
no side effects from drugs. So
If you were talking to the Chris of, say, 20 years ago, what would you have a piece of advice for that Chris in terms of like hair loss treatments?
I would have started using that much earlier.
Okay.
The Chris of years ago was much more skeptical, and I'm a very hard science kind of guy.
Yeah.
But the research is in.
Is in. So
You
you
just
would have
go to
started it earlier.
earlier. Go to Google Scholar now, and it's endless the amount of articles that pop up
Amazing.
regarding this. So
Well, listen, thank you so much for taking the time to chat with us and telling us all about the products today. It was
no problem. Thank you for your time.